beginning with David Chadwick, who was the medical director back in 1976, who convened the very first multidisciplinary team meeting here in San Diego, which basically evolved into the Chadwick Center.
I got interested in child abuse as a young pediatrician as a result of being dragged kicking and screaming, more or less, into the field by a social worker at the Children's Hospital of Los Angeles, where I started my practice in about 1958 or 59. Her name was Helen Boardman, and she actually insisted that I look at infants and young children who were coming in with repeated injuries and try to figure out what was going on. It was reinforced also by the fact that one of the people who had been one of my professors in school had moved to Colorado, Dr. Henry Kemp, and he was getting ready at that stage of the game to publish a collection of cases that he called the battered child syndrome, and that was a very seminal medical event that led us all, pediatricians, into the field. From almost the first day when we showed an interest at the hospital, the professional community liked that. When I say the professional community, I mean public social services, and in those days actually the probation department in San Diego County was doing some of the work in child abuse for the county. But the law enforcement jurisdictions, there were about 8 of them in the various San Diego cities, and the sheriff, they were all interested as well. And it was and is a strong community of professionals that are interested in child abuse here. That's how the Child Protection Team really got its start, and we based it at the Children's Hospital and began having meetings every Wednesday morning at 10 o'clock, which, as you say, started in the mid-70s and continued to the present time. If you look at something bad that's going on, and if you're a pediatrician, you're going to think about prevention. But a good program had started up in Colorado with home visiting by people who had been successful, mothers mostly, helping out young women who were having difficulties with their babies. When the center was born, and in those early days, we focused a lot on physical abuse and neglect. But by the end of the 70s and in the early 80s, we were beginning to see good writing about sexual abuse, and people were beginning to become more aware of that. And then somewhere in the early 80s, there was this seminal made-for-TV movie, something about Amelia with Ted Danson, and that played. And within 2 weeks, our referrals for sexual abuse just soared, and they were coming from law enforcement, they were coming from social services, they were coming from the medical community, they were coming from all over. And then we learned how to interview kids about sexual abuse, and we established that as a finite service. And we learned how to do the medical exams that might document sexual abuse in some cases. And we put together specific programs, and we began to see hundreds of kids that had that problem. We got the idea that to have a conference in San Diego on child abuse might be an interesting thing to do. There were a few conferences going on around the country, but most of them didn't emphasize the health aspects of the problem, and we were a health institution, so it occurred to us that maybe we could have a conference that was different and unique and special, and so we invited doctors and nurses to come to a conference on child abuse, and about 100 of them came. The next year that number doubled, and we went multidisciplinary, and we invited the social workers and the law enforcement people and the lawyers and the other disciplines, and the thing began to grow to where it's gone to its present. After our volume of diagnostic and forensic work began to increase, we were seeing more and more children, but we had a lot of difficulty in finding help for them, and a lot of them seemed to need ongoing mental health care. There was no particular program that focused on their needs. So after a while we invented one. It's become one of the most important parts of the center. We're not talking about something that's just going to go away overnight. I mean, we're talking about behaviors that are kind of ingrained in the human population. So in order to deal with things of that nature, you have to build institutions. None of us are going to live long enough to see the end of child abuse. If we could get it down 90% in a century, I think that'd be pretty remarkable.